Wow.
Crunch. Oh wow, that's truly incredible. It's absolutely amazing.
Damn it!
You're not helping me.
You are idiots. Wow.
Hello, dear friends.
I have problems. It's severe scoliosis and something with my spine. I don't remember the diagnosis anymore. There was something with the discs. So, a long time ago when I was a child, I had a fracture at age 7. And then I did a lot of physical labor. And apparently something shifted. And now I realize that one of my shoulders is higher than the other. Plus, I tend to carry my bag on one shoulder, and I know that's really bad for posture and the back. Also, I broke my leg once, and that too kind of. I realized that it affects the whole body. And constantly, I realized that it.
When you were 7, you had a compression fracture of the 7th thoracic vertebra. You wore a brace for a year. After wearing the brace for a year, physical therapy.
I did physical therapy and I swam in the pool.
Your leg, is it an extra one?
No.
No, but you break it, yes. Then at first they put on a splint, but then they say a splint isn't enough, so they put on a cast.
How long were you in the cast? A month and a half?
On crutches, not bad. Then you get the cast removed.
And again, you have physiotherapy and physical therapy. My dad helped me with my recovery because my leg wouldn't bend and it needed to be worked on so it could bend again
Because of the cast, because I didn't want to. Sorry for the brief commercial break. We've got some Italians laying paving stones outside. So back to the question about your leg. You wore the cast for how long?
a month and a half in a cast. Next. And since the cast went all the way up, I had to use crutches. After a month and a half, my leg stopped straightening, or rather, it stopped bending. And it was my dad who helped me with my recovery. He helped me work on my leg so it could bend again.
Is your dad a doctor?
My dad isn't a doctor, but he went through a very serious injury.
I have had the pleasure of working closely with you on your comprehensive physical therapy journey, providing dedicated support and guidance throughout your rehabilitation process.
With
You did exercises with resistance bands. He
came up with the injury and he is needed. He has experience, let's put it that way. So he worked with you on physical therapy, you did exercises with resistance bands, and he came up with the idea for me to roll shaving foam on the floor like this so that I would bend my leg. That's it. And in the end, we managed the leg to bend completely.
Here, people came up with the idea of rolling shaving foam and ended up curing themselves. Did you patent it?
No.
Not yet. It's not that simple. All right, let's move on to the leg bending, but you'll see desire is key. Here, people came up with rolling shaving foam and cured themselves. Did they patent it? Not yet. It's not that simple. All right, let's move on to the examination. Next, we have a warming massage and manual therapy. Let's go. Let's take a look at our symmetry. Which leg?
Did you break?
The one on the left side? Yes, indeed, the left one. All right then, let us now proceed to carefully compare these two items. You specifically will be holding the vibrant bright pink marker. Okay, what's next on our agenda? Please gently and slowly lower your arms. I am just going to, with careful consideration and preparation, begin the next step.
Periodically.
Just touch you there. Well, please don't get too upset or angry about this, okay? I understand completely. I will now proceed to move myself to the opposite side, traversing the entire expanse. I'll be moving along the very top, the highest point, which is the crest. Specifically, I'm referring to the distinct and prominent angles of the shoulder blades, those bony structures that are so crucial for movement and support. And more precisely, I'm focusing on the lower ones, the inferior aspects of those shoulder blades, observing their precise positioning and orientation. All right, that's the plan. And now let's try to line all this up. You need to raise it a bit higher. Well, let's assume this isn't a shelf. Well, there's approximately about 2 full centimeters here. So on the right hand side, we probably have around half a centimeter, I would even confidently say. Here, you can clearly see the excellent symmetry, but what I truly mean is that over there, we deliberately set the starting point a little bit higher. Do you understand exactly what I mean, dear parents? Here, the left shoulder blade is 1 centimeter higher, just like that. Here, you can determine it by the skin folds. I don't even know, we probably won't be able to lower the laser there. Well, in general, we can look and see visually. I'm aligning it by the skin folds. I don't know if you can see it or not. Next, here we have a distinct protrusion, then perfect symmetry. And here, once again, everything is completely the opposite. So, well, what do I think? Right leg high, then opposite, protrusion, symmetry, opposite, light on. In the end, and finally get started with the massage. So, we've already done the massage, we've worked on the legs, and now space with the spine. There's some muscle tone here. Don't be silent. Yes, I can feel it here. It's not the same here. Let's move on. Someone asked us a question about the lower back. But to answer her question definitively, we need to do an MRI scan. Somewhere around here we had a compression fracture in childhood. Here we'll be a bit more careful because Nina came in during childhood. Lordosis, well, I don't really see it strongly, but to answer her question definitively, we need to do an MRI scan. So, somewhere around here, we had a compression fracture in childhood. Here, we'll be a bit more cautious because I can't say for sure without an examination, as I mentioned before.
That's absolutely enough for now. Thank you very much.
Wake up, we're starting. Your job is to just simply relax completely. Oh, it's like someone accidentally stepped on some crunchy potato chips.
Such a truly beautiful and very wonderful.
Relaxed. More.
Wow, it's truly quite a party here. So,
Let's gently move on now and truly relax a little bit more. Wow, even more deeply and completely. Just let everything go. Please calm yourself down. This particular one, again, no, it's not what we're looking for. So let's carefully close it, then come back to us and gently turn around, facing this way.
on your immediate right side, however, the sensitive microphone.
Please, just come back to me. That's absolutely all I ask of you. I am truly hoping that you would consider reducing the space between us. My earnest desire is for you to draw yourself nearer to my presence. It would bring me a profound sense of comfort and connection if you were to gently and deliberately move closer to where I am right now. I long for the warmth and reassurance that your immediate proximity would provide, allowing us to share this moment in a more intimate and meaningful way. Turn your torso, rotating it a little bit more, feeling a gentle stretch. You should carefully engage your core as you articulate this movement. Now slowly transition to the other side, mirroring the previous action with the same deliberate and controlled precision, moving just a little bit more each time, ensuring a smooth and mindful rotation. Turn your torso just a little more. There, that's much better. And you say, now carefully turn to the other side. Go a little lower, closer to me if you can. Come on, let's start cracking and get this done. Good job. Lie on your back. Thoracic spine, please relax. I'm merely defending myself, you see. Now I will absolutely relax completely. Let's do it differently now. Let go, stop hugging yourself. Let her please go right over there immediately. Hands behind your head, lock them. Let's do it differently. Let go, stop hugging. Yoka, go over there. Hands behind your head, lock them. Yes, like that. Let me take this off. I am also present in this very location, sharing in this experience alongside everyone else. My arrival signifies my participation and my desire to be a part of whatever is unfolding. It's important for me to be here, to witness and contribute, and to ensure my presence is acknowledged and understood within this particular setting. I am fully engaged and ready to immerse myself in the current circumstances, demonstrating my commitment to being an active participant in this moment. Could you please tell me what specific movies you are currently acting in? We absolutely need to cut this particular segment out. I know with absolute certainty exactly how this entire situation will begin. Therefore, let's approach this in a completely different manner. Lock your hands behind your head. Can you play the Godfather? Could you please tell me approximately how many different languages do you currently know and are proficient in speaking?
Russian and Russian swearing.
What about Barnaul dialect?
No, absolutely not.
It doesn't get in the way. Rest your head on your chin. Wriggling like a snake. Really drop your shoulders. Don't be sneaky. More. Is that all? Is your acting skill over? Carefully turn onto your back now in a relaxed manner. Now you're going to immerse yourself in a state that you'll need to come out of. Ready? Let's transform. We're doing compression, actually decompression. So, how is it? That husband? No? All right. Just keep your chin up. Can you breathe properly, okay? All right. We are now doing a critical medical decompression procedure. Decompression traction. Breathe, okay?
Interesting.
Relaxed. Oh, do you actually remember what it's called? What was that? Do you recall?
Decompression.
You're almost a doctor already. All right, now the legs. Left, right? You left? Yes, left, left. Okay, this one. Excellent job. That's really well done. Now I need you to carefully and slowly turn over onto your stomach, making sure you're comfortable in that position. Come on, I'll gently and completely take this particular item away from you right now so you don't have to worry about it anymore. Now it's your turn to really engage. On your elbows, firmly on your elbows. You are almost there. Come on, transition smoothly onto your forearms. Yes, bring those elbows together. That's a really good job. But remember, don't pull them. Always look straight ahead and just relax completely. All right, I'm done. That's it. Let's get up. Tell us how you're feeling. Share something with us. I'm showering. This one's setting traps, one thing after another. Walk over here. So please share with our valued viewers what you truly felt. It's hot in here, windows closed. Tell us what you felt or didn't feel.
Whether people should book an appointment with me or not, I can definitely say, oh my God, I feel lightness in my body, so yes, you definitely should book an appointment, but it's scary, really scary. I'm a pretty brave person, even more than most, but still, yeah.
The compression cracks, but you actually get noticeably taller. By the way, we have many patients who undergo these specific kinds of treatments in comprehensive courses for a very long period of time, and they actually become significantly taller. Yeah, I mean,
I didn't actually measure them myself, they were just there sitting quietly, waiting to be observed and recorded.
measure themselves.
And the guy was about something like a few centimeters taller, and the girl was a centimeter, another one. There's a kind of lightness throughout the whole body, honestly, all over, like all those other things like massage and so on. Yeah, they're good too, but it's not the same. It works differently. And if we're talking about some fundamental changes in quality of life, then definitely all those other things like massage and so on, yeah, they're good too, but it's not the same. It works differently. And if we
Look at
fundamental changes in quality of life, definitely.
this is medicine.
Thank you.
That this exists and that you make us healthier. Maybe we should put those Shrek eyes on if we're being honest. Nina has her own issues. This needs to be worked on, and she probably, well, judging by, well, you see, specifically regarding panic, she has her own issues. This needs to be worked on, and she probably, well, judging by what I saw, I think she's ready. She'll start and she'll succeed. We'll leave her contact info under the video. Just kidding, actually. No contacts or anything like that.
No. All right then.
If anything, just look for her. Which neighborhood do you live in? Okay, that's all for now. Thank you all for watching. Nina did a great job. We'll keep working with her. I think she understands that perfectly well herself. She does have a number of issues, but they're solvable, and really everything will work out. That's about it. Nina did a great job. She has solvable issues and everything will work out. Or at least send some photos. Don't forget about us, at least as baggage or something. Or at least send some photos. Alright, thank you all for watching and see you next time. We'll see each other soon. Like the video. Discuss those likes.